Hello, Amy here, and I did my flashcard presentation on left-sided heart failure. So the disease process for left-sided heart failure, or LSHF, is a disease where the left ventricle of the heart is unable to pump blood effectively enough to the systemic circulation. This leads to the backfill of blood into the pulmonary circulation, which then results in pulmonary congestion, which then decreases oxygen delivery throughout the body's tissues. There are two different types of heart failure: systolic, where the ventricle cannot contract effectively, and diastolic, where the ventricle is unable to relax and fill. The pathophys of it is the left ventricle becomes either weak or stiff in LSHF, which then leads to inability to eject blood into the aorta effectively. The result of that inability increases left ventricular and diastolic pressure, then backlogging blood into the left atrium and pulmonary circulation. That increase in pressure in the capillary or pulmonary capillaries leads to fluid leakage into the alveoli, which causes pulmonary edema and impaired gas exchange. Over time, the body's compensation mechanisms, like activating the RAS system or the sympathetic nervous system, causes vasoconstriction, sodium retention, and myocardial remodeling. Risk factors are hypertension. Having a chronic high blood pressure increases cardiac afterload, so then it's harder for the left ventricle to pump blood, which then leads to eventual failure. Coronary artery disease is plaque buildup in the arteries, reducing blood flow to the cardiac muscle, leading to ischemia and weakened heart muscle. Myocardial infarction is the lack of oxygen from a heart attack and occlusion that damages the cardiac tissue, reducing pumping ability on the left side. Diabetes contributes to endothelial dysfunction, which then increases the risk for hypertension and coronary artery disease. Any valve issues, so that'd be stenosis or regurg, can lead to an increased workload on the left side. Then also there's lifestyle. Obesity, smoking, drinking alcohol, food can increase the likelihood of cardiovascular disease. Signs and symptoms and their causes: shortness of breath or dyspnea from pulmonary congestion and edema, difficulty breathing while lying flat, which is orthopnea, and that's from increased venous return, makes pulmonary congestion worse. Fatigue and weakness is because of the reduction in cardiac output. There's less oxygen getting to the muscles. Lung sounds, so pulmonary crackles, that extra fluid in the alveoli results in abnormal lung sounds. Cough with pink, frothy sputum is from usually severe pulmonary edema that leads to fluid leakage in the alveoli. So a lot of times you'll see that with if someone's like coughing up pink, frothy sputum, they're in flash pulmonary edema. And then tachycardia, and that's because the heart's trying to compensate for the poor cardiac output, so then the heart rate increases. So there's some diagnostic tests. An echocardiogram that shows the abnormalities, or that can show the structure of the heart, any abnormalities, and identifies left ventricular ejection fraction. A chest x-ray can detect pulmonary congestion and cardiomegaly. Electrocardiogram, or an ECG, assesses for arrhythmias or ischemic changes. And then a coronary angiography shows occlusions in the cardiac arteries to see if there's any underlying ischemia. And that is it. Thank you so much. Have a good week.